Greetings, friends. Kambria Evans here, the teaching and learning EMDR consultant. And y'all, today on the Zero Disturbance podcast, we are answering the question that everybody asks, which is, who is an ideal candidate for EMDR? Now, I would bet the farm that the majority of therapists would say someone who's had trauma. And we're going to unpack this a little bit today because my answer is going to be a lot different than what you might have heard before. And my hope was that by the end of this episode, I will be able to convince you that every damn person in the world is an ideal candidate for EMDR. Why do I say that? Well, correct. Yes, EMDR is a fantastic brain-based modality for trauma therapy. It's amazing. And it's proven in tons of research papers. Okay, we know this. We know the body keeps the score. We know EMDR incorporates the body, right? This beautiful configuration of like CBT, exposure therapy, bilateral stimulation, taxing the working memory, somatic experiencing, all the therapies are combined in EMDR. Okay, so of course it's going to be great for trauma. But here's the thing. Everyone's had trauma. Because what is trauma? Trauma can be defined as an experience that we have that, when we think about it, still has disturbance for us now. Okay? So, I have not met one person in the world who's not had something traumatic happen to them, at least one time, right? I have not met one person in the world who now, in the present time, has zero disturbance on past trauma without doing EMDR. Now, if you exist, please email me. I would love to meet you, and I'm so happy for you. But this is just not the norm. It is so far from the norm. And here's the thing. Most of us don't even really self-identify as having had trauma because we tend to associate trauma as like going to war or being assaulted or growing up with like really, really intense physical abuse, right? All of those things are traumatic and they do create PTSD symptoms and complex PTSD symptoms if we have kind of relational trauma with a caregiver. But here's the thing. A lot of us have had traumatic experiences and we don't even know they're kind of in the category as being trauma, right? They make us feel uncomfortable now. They make us feel disturbed now, but we don't think of ourselves as having had trauma. So the problem, the branding crisis with EMDR right now is that EMDR is being branded as a trauma therapy. Well, here's the problem. You are not using language that allows people to understand, first of all, that they could benefit from EMDR because you're kind of cutting them out of the invitation because they don't self-identify as having had trauma. Okay, so why do I think that everyone is an ideal candidate for EMDR? Well, here's how I think about EMDR. Yes, EMDR is amazing for past prong trauma work, right? In EMDR, we have 3 prongs of time. We have the past, the present, and we have the future, okay? But what is so underutilized in EMDR and needs to change fast, is having therapists talk about the benefits of EMDR for everyone. Not just in the past prong, not just what we all consider to be trauma, right? But in the current, present prong of time and the future. Why are we only talking about the past and the trauma? We're totally underutilizing and ignoring and neglecting the power of the present prong of time and the future prong of time when it comes to EMDR. I'm going to talk about this a lot today, but like, how are we only talking about and branding the past trauma prong? That's 1/3. Like, why aren't we talking about these 2/3 of what EMDR can do for people? This is crazy to me, right? It's like saying to somebody, I have this incredible place we can go. It's a lake house and it's beautiful and it'll make you feel good in your body. It'll make you feel empowered. It'll make you feel like I am good. You'll feel safe there. But we can only go there on Tuesday and Thursday. Why? We're not going to use it the other days of the week, right? It doesn't make any sense. So we're going to make people make sense today, okay? So here's who I think is an ideal candidate for EMDR, okay? It's everyone. Why? Because if you are a person in the world who has learned anything that is positive or negative, okay? If you are a person in the world who wants to experience congruence in the curriculums you've been exposed to, if you are someone who wants to increase the clarity that you have in your body and you want to have a calm body, right? If you are somebody who wants to have more empowerment in your emotional experience in the world, right? Then EMDR would serve you, okay? It would completely serve you. And what do I mean when I say congruence with curriculum, right? I'm using all this teacher jargon. What I mean by that is we all learn things all day, every day, right? We have people telling us messages about ourselves when we're kids, whether it's our parents or our friends or our teachers. We have internalized self-talk. That's a curriculum, right? We have messages from society based on our gender, race, orientation, socioeconomic class. We have messages about who we're supposed to be, right? And who we're not supposed to be. And those messages and those curriculums are often incongruent with other curriculum and messages we've gotten before, right? So just being a person in the world, we are walking around holding a lot of competing voices inside of ourselves, competing curriculums inside of ourselves, right? And as a way to prove this to you, I want you to go back to your belief inventory guide, okay? This was part of the resource library that we offered for therapy clients. And we wanted you, as a reminder, we wanted you to look at kind of your inventory of positive beliefs, inventory of negative beliefs, okay? Now, how is it that one person can believe very strongly, I am good, but then also, with the same category of cognitions and beliefs, believe I don't deserve love or I am not worthy? How is that possible that I can have this belief and they are incongruent? The reason that exists is because you are a person in the world, period, right? Every single person walking around has incongruent messaging and incongruent curriculum inside of themselves, right? I just took my kids to second grade last week, and it's the equivalent of like me walking into their teacher's classroom and there's just shit everywhere. It's like, there's some lesson plans and like there's some lesson plans and there's some reading tools. It's like, this is not organized. Like, no wonder we have all of this anxiety and depression and sleeplessness and body sensations and worry. Like, no wonder we feel this way. Nothing's wrong with you. Nothing's wrong with you, right? This is just how we have to hold incongruent messages in our body every day, all day. Okay. So what does EMDR do with incongruent messages? I'm going to tell you what it does, because this is the coolest. As an EMDR client, this is the coolest thing I love about EMDR. EMDR helps me understand what curriculum is there, right? And you've already started this. You've already started this because you have mapped out your positive beliefs and negative beliefs and how strong they are. Now, how strong they are is an indicator of how impactful that curriculum still is to you, right? How strong those beliefs are is an indicator of how those curriculums have been internalized inside of you as true or not true, okay? Okay. So we have all this curriculum inside of us. And the reason I love EMDR, doing this with my clients here in California, doing this as a client with my own EMDR therapist, I get to understand what are the messages and curriculums inside of me? And it's not just cognitive. Like I was in talk therapy for a long, long time. I think it has a lot of value. But this isn't just like a cognitive curriculum. This is not CBT. This is CBT plus, because we're looking at the body, right? The body keeps the score. We can all agree. The body has a curriculum inventory system. How cool is that, right? The body understands that what we have internalized in the mind, even if it's incongruent, the body, it has dropped down to our bodies. Amazing if we know how to utilize this to our advantage. Torture if we don't, right? Torture and PTSD symptoms, anxiety, depression, all the things we've mentioned. Okay. So I hope by now you're understanding that you are a candidate for EMDR therapy, right? And that you doing EMDR doesn't have to be because you've had some horrible, traumatic event or events happen to you. It can be just because you're a woman. Let's talk about the incongruence of women's curriculum, right? Okay, you're a woman, and let's say that you hit puberty and you start to grow breasts. Well, you can have breasts, but you need to be modest with them. And you have nipples, but you have to cover them and make sure that they don't poke through your shirt, right? You get a period, but you're not supposed to talk about your period. And why am I still 43 years old taking my tampon out of my purse and putting it up my sleeve to walk down the hall to go to the bathroom? Because I'm not supposed to let people know I have my period, right? So just as a woman biologically in society, we are taught you have this naturally given to you, but you have to, go ahead and be this, right? Our expectation is that you hide this part, you show this part, but then even that's incongruent, right? We turn into teenage girls and women. You should be sexy, but don't be a slut. It's like such an incongruence. It's such a confusing, disorienting position to be a woman right now, and probably always, okay? And there are lots of examples of why we have incongruent curriculum. Again, it's not our fault. It's not our fault. We're just taking things in because we just want to learn. We want to learn how to be safe. We want to learn how to be good. We want to learn how to be connected. That's literally the intention of everything we're learning. Like those are the things we're typically trying to get since we're born, basically. Okay. So why do people go to therapy? Why should people do EMDR? It's been really interesting to work with people who have had a lot of severe trauma. I've had many clients like that. And what's really fascinating to me is that I also get to go into the present and future prongs of time with a lot of my clients. Because what typically happens is they'll come for some childhood trauma, they'll come for some anxiety, they'll come for some symptom, right? And we might do some trauma targets in the past, right? But really where the amazing expansion and power of EMDR really comes into play in the present and the future is when those trauma targets have been desensitized, right? They've been quieted, they've been soothed. Those younger parts or those parts in the past that are stuck in misery, alone, confused, disturbed, upset, we go back on a rescue mission and we go get them. We go get them and we bring them here congruently in time to be safe with us here now and loved and accepted, okay? So these past things are soothed. Now, this is where a lot of EMDR therapists will say, okay, we're done, you're great now, go, God bless, have a great life. And that's not wrong. But what's really amazing is when I get to stay with my clients and we get to think about what they just did, because they're super confident about doing that. And then when they say to me, you know what? I don't have the PTSD symptoms. I don't have the sleepless nights. I don't have the phobia. I don't have the rage. I don't have the same level of intensity of triggers that kind of send me back to an unsafe time where I had to get big and protect myself, or I had to get small and quiet and freeze and I couldn't talk. I don't have those anymore. But what I'm realizing is there's a little cleanup here. There's a little cleanup here that I want to do. Now, what do I mean by that? When we desensitize things from the past, we typically move from a negative belief to a positive belief, like I'm unsafe to I'm safe now. Or, a very common one from childhood, I am bad to I am good. Once people do the belief inventory and they do some trauma targets, they do some EMDR, then they're kind of like, wait a minute, there's some positive and negative beliefs that aren't super strong, but they're still there. How can we kind of figure out how to clean that up so that I have more positive beliefs and fewer negative beliefs? Notice that I'm not talking about trauma targets. Notice that I have not once said clients should write down all of their traumatic events and we should go through them. No, I don't do that, right? I look at the curriculum inside, what has been learned that's incongruent. And we notice the biggest incongruencies. And I ask the client, do you want to start there? A lot of people don't go to EMDR because they don't want to go back to their childhood traumatic memories. They don't want to go back to their assault. Torture to do that. And guess what? They don't have to. They can start in the present prong because we know that any belief we're working on that's attached to any event or any learning, the belief is what generalizes. The belief and the body sensation that are attached to each other, that is what generalizes. So even if we're not in the past trauma prong, we're in the present or even the future, we're still doing all prongs of time here, right? Because y'all have heard me say this, the brain doesn't care what time it is. Like we made that up, right? But the brain has memories and learning from the past, from the present, and from the future. The brain imagines the future, and the brain has been imagining your future since you were born, since you started daydreaming about what your life was going to be like. Right? As things started to happen to you, your brain linked to the future to say, well, if this is happening now, then this, and this will happen in the future. Okay. So when we do this cleanup, right, and kind of in the present, and we kind of say, what are my limiting beliefs that I want to just kind of like knock out? I want to get more positive cognitions, right? Then we kind of move into what's called performance enhancement. What does that mean? Typically, we think about this with EMDR as like, there's EMDR and brain spotting clinicians who work with athletes or actors, actresses, CEOs, people that have to perform something. They use the current and future prong of time to help them become excellent at what they do. Why the hell are we not all doing this? Please, someone give me a good reason why we're not doing this. This is the power. This is the power. Could you imagine what it would feel like to walk around with a mind and body that believed every single positive belief on your belief inventory guide? You know what's so sad to me is that we don't even think that that's a possibility for us. Like we have stunted our growth in the mental health community by saying, well, we're trauma therapists, and so we clean up the trauma, we clean up the past prong, and then, oh, you want to do positive building? You want to do expansion with resources? You want to do, oh, that's like what coaches do. That's not what therapists do. What are we saying? Every EMDR therapist, I am tasking you right now, and I hope you will accept my invitation. If you have someone that's come to you for trauma and you're utilizing EMDR, take them all the way to the future prong, not just on their trauma target, but on every single negative cognition on their belief inventory guide. Why should you do this? Why? Right? We're taught in therapy school that we're supposed to be focusing on mental illness, but we can't talk about mental illness without talking about mental health. And just like when you have a primary care physician who is going to be responsive to the needs of your physical body, preventative care is part of the jam. It's part of the job. Why have we as therapists disconnected from these prongs of time, from these resources, from these adaptive material creations? It makes no sense. Please stop. Please stop. It is not up to the coaches who are not trained the way that we are trained to do this part. You do this part. Why? Because if we all as EMDR clinicians did this part, the performance enhancement, the cleaning up the negative cognitions, the strengthening of all the positive cognitions, do you know what we would have? We would have an army of people walking around completely self-actualized, completely congruent, completely empowered on their terms, confident, safe, calm. Could you imagine what the world would be like if we built that armor for them. It is not enough to take them and clean up the wounds. I'm calling bullshit on that idea right now. We need to give them armor of self. Because the rest of the world's still going to be giving them curriculum and all the negative cognitions and all the traumatic experiences. We don't have a way to protect people from that. But we can give them their own armor to walk around into the world. And guess what? Do you ever notice how when you're around somebody who has competence and curricular congruence inside of them, and they're living their positive beliefs, not just here from talk therapy, but in their body, because EMDR drops it in, drops it down, and expands it. Could you imagine what that would do for all those people's children? We're talking about cycle breakers. We're talking about intergenerational trauma. Give them armor. This is the time to give them armor. If you are somebody who is thinking about doing EMDR therapy for any of these reasons, right? If you are someone who is in therapy, I'm empowering you and giving you permission to demand this. Your treatment plan is not done. It is not done until you have all your PCs strengthened, which is a different treatment goal than we're going to clear these trauma targets and then you're going to go off into the world. And if you want to keep going from there, you got to go work with a coach who, by the way, hasn't had years and years and years of client experience and mental health training. Okay, I'm making a call. Join me in this. It could be so amazing. And this is what I do in my practice. And it is like electrifying for me as a clinician. It is electrifying for me. And this is actually, I think, the cure. This is the cure for therapist burnout. Stop only doing trauma work with clients and then sending them off. Do the trauma work. Beautiful. Thank you for doing that. It's hard. It's hard to hear. It's hard to be with. And give yourself and your client the gift of taking them through the present prong of time, cleaning up their belief inventory, negative beliefs, giving them more positive cognitions, not just in their head, but in their body, and take them all the way to the future prong with performance enhancement. That is not connected to performance enhancement of their trauma targets you just cleared. I'm not talking about doing the future prong check of a trauma target. I'm talking about saying to them, tell me who you want to be. If we could rebrand you and you could reset yourself, tell me the positive beliefs you'd want to have. Guess what? They want all of them on the list. Why not? It's Christmas, okay? Santa Claus is coming to town. Give them everything. Why wouldn't you do this? You deserve this as the clinician to be a part of because it is inspirational. Because when people clear trauma, they actually get to know themselves for the first time. But when people are strengthened, oh, they become superheroes. They become themselves times 100. It's amazing. It's so amazing. So, therapists, I'm asking you to think about this in your treatment plan. No, redo. So, therapists, I am giving you permission to do this in your treatment plan. And clients in EMDR, those of you thinking about EMDR, demand this. Demand this in your treatment plan because you deserve this. You absolutely deserve it. Can y'all tell this is so important to me? As a client of EMDR, I have magnified negative cognitions, looked at them. I've done trauma targets. Some of them have been fragments of things I couldn't put like clear pictures to or clear words to. I have felt sense. We did all those targets. We cleared them all out. And now I'm in this amazing point in my EMDR therapy where I feel so limitless. Does shit still happen to me in my life? 100%. I'm a person in the world. Do I still get curriculum from people who know me or people in society about who I should be as a mom and who I should be as a woman and who I should... Of course I do, right? But my armor, my congruence, my clarity of myself because I can feel myself, because I belong to myself. I want everyone to experience this. And I'm not done. I mean, I'm going to be doing EMDR for a long time when I want to clean things up because curriculum comes and I just go in and do a little tweak. I am for sure going to have more traumatic things happen to me in my life, but I am going to use this modality to get me through it. 100%. Okay. So I want you to think about, am I an ideal candidate for EMDR? If you had a magic wand, and maybe you're looking at your belief inventory guide, maybe you're seeing all those negative beliefs and all those positive beliefs. You're seeing all the assets you already have developed. You're seeing all the places where you have received bullshit curriculum or you've had traumatic experiences that have impacted you. If you had a magic wand, what would that belief inventory guide look like? That is your treatment plan. Should you be going into EMDR, hopefully with a skilled clinician, or if you're in EMDR now, that is your treatment plan because you deserve that, okay? I want you to think about the parts of yourself that have been covered up, the parts of yourself that have been silenced, that have been lost, that have been forgotten, fragmented even from yourself, the parts of yourself that feel scared, that don't feel good enough, and just having empathy for the parts of ourselves that have just been told a bunch of bullshit. We've all been told so much bullshit, right? You deserve to get clear about what's real for you. Okay, that's kind of, I think, the point of being alive. So I have a worksheet that you can get in your Zero Disturbance client library. It's free. And it's going to help you guide yourself through this thought process. I'm asking some really philosophical, spiritual, hard questions right now, and they are so damn important. They're so important because you're so important, right? So the question I have is, if we understand that the most precious thing that we can own in life is our own emotional experience, and we understand that most of us have given this away without even realizing it, and we understand that we are not living as congruently as we possibly could, because congruence in your body feels so spacious and so safe and so relaxing, right? I want you to belong to yourself. I want you to belong to yourself. Okay? So my invitation is that you will think about your limiting beliefs, think about your positive beliefs, think about how can you belong to yourself even more than you already do? How can you call back the pieces of yourself that have been fragmented and confused and, right? You deserve that. So I truly hope that today's conversation has been in service to you, whether you're a client or a therapist. I say all of these things out of love and with a call of urgency, because there needs to be a profound shift in the way that we conceptualize and deliver mental health care. What's happening now is not good enough. And we have all the stats to prove it. Okay? And I also hope that me saying this today has helped all of you thinking about therapy or EMDR or even brain spotting or art, because they're EMDR informed. You can have this experience. It's a different flavor of self-love and self-work than trauma work. It's a different flavor, okay? And I think that, when we go into an ice cream store, not everybody wants vanilla. That's why they have more than one. So as a clinician, task yourself, how am I talking about EMDR? How am I branding my services? Why am I only taking my client through the past prong and then forgetting about 2/3 of the lake house, right? The lake house visit, the calm place. How can I expand my clients all the way into all the positive beliefs? Because, by the way, when did someone decide that wasn't part of what we're supposed to do? When did someone decide that wasn't what we deserve? We're challenging all of this bullshit together. And it's really, really exciting, you guys. So exciting. So with all of that being said, I deeply enjoy having these thoughtful conversations with y'all. I truly hope that the Zero Disturbance Client Library is in service to you, whether you have a therapist or not. These are all things you can do to be thoughtful about yourself in service to you. So I look forward to being together next time. In the meantime, please take good care. You deserve it.